Now the thing is, what is the difference if you fall ill in in comparison to another social protection thing like becoming old or yeah, that's the main issue, for example, becoming old. What is the difference here if you fall ill? There are two things happening at the same time. Your need for money goes up because you're ill. You have to pay for a doctor, medicine, hospital, blah, 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 whatever. Your ability to earn an income goes down. So what you have is like this. At the same time, this goes down and that goes up. So are both things involved. And I think this is important what you mentioned. The key question is, which one do we want to tackle? If you look at the German system, for example, when it evolved in the 1880s or 130 years ago, initially it was all about getting this up again. So you got money when you were pregnant. You got money to buy a coffin when they were dead. You got money for compensating your inability to earn an income, to work. Because in 1880 there was not much in terms of medicine. Some heroic surgery, some more or less effective medicines, and that was it. No CT, no MRI, no PET scan, no left heart catheter, all these nice things, virtually non-existent. Okay? So this bit, that wasn't the issue. This bit was bringing up the level of income, available income. And that brings me to the second point, the issue of the financing. Now here's the economic bit. We often talk about financial hardship. So what is financial hardship? How do you define, they talk about financial hardship, but the question, what do you mean by financial hardship?
Not being able to meet your basic needs.
Yeah, well, we're talking about financial hardship due to healthcare expenditure. How do you define financial hardship due to healthcare expenditure?
Falling ill.
Yes?
Spending the little money you have, or to cure yourself, and later become broke because you spent all the money on it.
Okay, so the issue is to become broke in a sense of impoverishing health expenditure. Okay? But then again, what is meant by that? Sorry, I'm coming back to you, Ayumi, because you're on the one side of the scale here. If Ayumi has to spend 1,000 euros, will she go broke? No. Even if she pays out of pocket, right? If some of the other countries, you have to pay 1,000 euros, that's end of the story. I remember Nepal, there was a family going, and I learned afterwards I think they had to pay 1,000 euros. Yearly income was about $300. Then you have a problem. So the question is, you have to relate the level of payment to what you have. Right, that's number one. And secondly, how much out of total expenditure for health is paid what is called out of pocket? Is everybody clear with the out of pocket? Go on. I didn't get it, sorry. Yes?
Okay, is our expenses.
Yes, what you pay directly at the point of service. Okay? So it's not covered by private health insurance, it's not covered by social health insurance, it's not covered by the government. Okay? So, out-of-pocket expenditure. What is the ideal level of out-of-pocket expenditure? Is it? Why? Are you sure? What happens if you have zero out-of-pocket expenditure? What happens? Ah, there we go. You see what I mean? This is my favorite. Where's my card? Here. This is my free entrance to the German healthcare. Actually, the Italian healthcare system too. I could go to a doctor now, present this card, and I get treatment. It's quite nice, isn't it? Free. Free. Now, should it be all free? Should it be 0, my co-payment? You see what I mean? But you're absolutely right. The issue of moral hazard. Have you done anything on this insurance? Not yet. Have you? Last week? Okay, we'll do. Moral hazard is important. The idea is moral hazard. I'll just put down the... Do we have a pen on this? Thank you. Moral hazard. That means if somebody pays your bills, you act a little bit more reckless, subconsciously so. But essentially you say, look, if everything is going to be paid for, I might as well go for it, because somebody picks up the bill. Okay, the idea of moral hazard. A very central concept in economics if you talk about insurance. Fundamental. So if you say 0% co-payment, you have an issue with moral hazard. Okay? Imagine everything were for free. Mind you, empirically proving moral hazard is very difficult, because that means what is the right level of health care to consume? Should it be everything? How often is good to see a doctor? Twice a year? 5 times a year? 10 times a year? 20 times a year? Okay. So the issue is, if you are insured, you're talking about moral hazard. Now, this is the thing about selling insurance. You sell somebody an insurance. Okay? He has to pay, or she has to pay day in, once a month. And if this person is lucky, she will never get anything out of it. You have to consider yourself lucky. And that's extremely difficult. Okay? I'll pay and I'll pay and I'll pay for something which I hope doesn't happen. See, it's very difficult to sell this idea of insurance here. Yes. Now, so we are clear, 0% is probably not a good idea. You want some element. Okay, Myanmar. Sorry, you're at the extreme spectrum. Out-of-pocket expenditures as percentage of total health expenditure in Myanmar. Yes, the total health expenditure in Myanmar is $30 per head. Okay, 15,000. No, what is it? 1,000 chat is a dollar, huh? 30,000 chat. How much of this is paid out of pocket? Do you know by any chance? Yes. What do you think? $30 Myanmar per capita. 95% is out of pocket. Almost everything. Myanmar, the Burmese states pays very little to cover this. Okay?
But it changed now.
Slowly, yes.
But it is already
Trying to work on it, yes.
and it is almost free.
Yeah, but what do you get?
Otherwise
See?
it depends on the condition.
Exactly. If there's the usual thing, in theory, the medicines should be for free, but I'm afraid there's no medicines. But here's my little shop, you can go and buy. So 95%. How about Germany, Italy? I don't know about Japan. I must say Hong Kong. Any idea? Out of pocket, roughly. OECD. Oh, Turkey's very good actually. Low out of pocket. We're talking 15 to 20% out of pocket expenditure.
We are starting to increase.
It's getting up again in Turkey? Oh, I see, okay. But it used to be, that's my information, it's very good. It's an example for other countries, okay. Because you have like aspirin, no need to pay, the state to pay. If you go into, some countries, you have yellow fever vaccination. Why should the National Health Service pay for yellow fever? If you have the money to fly to a country with yellow fever, you should be able to, interesting is also the contraception, whether it should be covered or not. It's a very interesting case. Yeah. Lots of in Germany it's covered until 18. After that it's not. So there, dental.
No, dental is looking.
You could say you don't die of rotten teeth. It's your problem. It's a aesthetic problem. Okay. So the question is then, think about it. That would be a nice exercise, but maybe not now. Just some very basic figures. And you just ask yourself whether you know this. You look at the gross national product of your country, GNP. There we go, yes. Then the question is, of this GNP, the percentage spent on health. Okay, also called total health expenditure, THE. Okay, out of this total health expenditure, the question is, what is public and what is private? And here you could say private is private health insurance or out of pocket. And here could be social health insurance or just some sort of NHS tax-based. But you can also put this together.